So guys, we have discussed about superficial mycosis, right? So in superficial mycosis, the first example which we discussed was Tinea versicolor or Pityriasis versicolor. So now we shall be discussing about that in superficial mycosis. In case of superficial mycosis, we discussed an example. Superficial mycosis, first of all, you need to know that it affects only the superficial layers of your skin. Okay, it affects only the superficial layers of the skin. Okay, so the first important thing is your Tinea versicolor. Tinea versicolor or Pityriasis versicolor. It is also called as Pityriasis versicolor. Okay, so there are basically two names. One is called as Tinea versicolor or Pityriasis versicolor. If you look at the picture down here, right, so this is the picture of Tinea versicolor or Pityriasis versicolor. As you can see some patches over here, right? So these patches are nothing but called as the hypopigmented patches, right? So as you can see, these are the hypopigmented patches. These are the hypopigmented lesions or the hypopigmented patches which you can see here, right? So these hypopigmented lesions or hypopigmented patches, actually patient will not have any kind of symptoms, nor there will be itching or burning, anything. So there will be just hypopigmented lesions. And next important thing you need to know is that this is out of all the fungal infections, this is a very common cutaneous fungal infection. Okay, so this fungal infection is called as very common cutaneous fungal infection. So this infection is characterized by patches as well as macules which are hypopigmented. Okay, patches and macules which are hypopigmented, right? So which group of people will be affected? What are the risk factors of this? Let us now discuss about the risk factors, right? So what are the risk factors? Which group of people? So those group of people who are living in a hot and humid weather, right? And those group of people who are all the time having sweat on their body, right? So these group of people, the fungi grows very well on them. Okay, so two groups, one is called as hot and humid weather, hot as well as humid weather, and the second important thing is excessive sweating. Excessive sweating. So these are the two important things where this fungus will basically grow. So Pityriasis versicolor or Tinea versicolor is not a organism, it is a disease, right? So what is the causative agent? What is the etiology of this disease? This disease is caused by Mycoses globosa as well as Mycoses furfur. Okay, so there are two important things. One is called as Mycoses globosa, okay, and also Mycoses furfur. So Mycoses globosa and Mycoses furfur together cause this, but most commonly the organism which causes is Mycoses globosa in comparison to Mycoses furfur. Okay, now how do I diagnose this condition? There are two ways I can diagnose this condition. So diagnosis, I can do this diagnosis by two ways. What is the first way is that I call the patient, and what I do is that these hypopigmented lesions, whatever are there, I will scrap these lesions. Okay, I will scrap the lesions. After scrapping whatever powder or whatever comes from the skin surface, whatever I collected, right, to that I will add potassium hydroxide. Okay, so for example here there is a hypopigmented lesion, I will scrap it completely, I will collect that scrap, and next I will add potassium hydroxide into that. After adding potassium hydroxide into that, when you put it under a microscope, you would find this kind of appearance. You would find some balls like this, some balls, these are called as your fungal balls, right? Along with that, you would find a lot of thread like appearances like this. So this is looking like a spaghetti, right? These pink color molecules are your spaghetti, and these black color balls are your meatball appearance, right? So this kind of appearance you call it as spaghetti meatball appearance, spaghetti meatball appearance, right? So what am I doing with the patient? What am I doing with the patient is that I will take a skin scrap. To this skin scrap I am adding potassium hydroxide solution. Okay, to this skin scrap I am adding what? I am adding potassium hydroxide solution. Now after adding this potassium hydroxide solution, this is what I find, right? Look at this. This is a spaghetti meatball appearance, right? So just look at the picture down also here. So these are your meatballs all over, and these are your spaghetti all over, right? So this is looking like a spaghetti meatball appearance. So this is called as KOH mount test. Okay, now the next way how do you diagnose is that call the patient and pass UV light onto these lesions. So what are you doing? You are passing which light? You are passing UV light onto the patient. When you are passing UV light onto the patient, it means the UV light is directly hitting the lesion. It is the UV light is directly hitting these lesions, hyperpigmented lesions, which means the UV light is directly hitting the fungi which is present there, that is Mycoses, which also means the UV light is hitting a small pigment which is located within the fungal cell wall, that is called as pteridine, right? Within the fungal cell wall you have got a pigment called as pteridine. When you are passing UV light, the UV light exactly falls on this pteridine, and what will pteridine do? Pteridine will reflect a light backside. Okay, it will reflect a light backward. So when it will reflect a light backward, this is how you can see. You can see some stars appearance, right? So actually the picture is not clearly visible, but basically say that this is a fluorescent light, right? And it is also called as a golden yellow fluorescent light. Okay, so when you are passing UV light, what will happen is that this UV light will directly fall on pteridine pigment. And where is this pteridine pigment located? This pteridine pigment is located in the cell wall of Mycoses. It is located in the cell wall of the fungi, and from here it will reflect a fluorescent light. It will reflect a fluorescent light which will look like golden yellow. So this is an important thing, and this test which you hear, this is called as wood lamp test. So one test where you use KOH is called as the spaghetti meatball appearance, right? You would find spaghetti meatball appearance, and the other one is your wood lamp test. Okay, the treatment which you give here is that we tell the patient to use a shampoo that is comprised of 2.5% of selenium sulfide. Okay, selenium sulfide 2.5% shampoo. Selenium sulfide 2.5% shampoo. Not only that, we can also give ketoconazole shampoo. Ketoconazole shampoo to the patient. Okay. Now, apart from this, regarding the after the shampoos, we can also give some tablets, right? So you can also give tablet itraconazole. And you can also give tablet fluconazole. Itraconazole as well as a tablet fluconazole, right? So this is all the things, important things which you need to know regarding this Tinea versicolor or Pityriasis versicolor, guys. So thank you so much for watching my video. Goodbye.